People see you as such a smart guy that think, oh, there's nothing wrong with him, he's fine.
Yeah.
But when you're here and you can, show, actually, this is what's really wrong, and this is really taxing me, I think
totally.
it really kind of helps people understand that it doesn't matter how smart you are, you can still get a concussion and suffer. So my name is Alina Fong, Dr. Fong. I am the clinical director here at Cognitive FX, and this is kind of the brainchild, no pun intended, of Dr. Mark Allen and myself.
I've been very impressed with your team and the whole machine you've built here. It's really in strong contrast to all of the healthcare concussion and not that I've had in the past 5 years. It's pretty impressive. As I've been going through the treatment this week, I've had tons of questions that have come to mind. When I first got my concussion, and this is my second concussion, I didn't really know what to do on day one, and you get a lot of conflicting information. What do you recommend someone do in, say, who knows that they have a concussion, but in the first 24 hours, in the first week, in the first month, and then, if their symptoms persist, into the first 3 months?
That is a great question because so many of our patients don't have the right guidance, and there's so many medical professionals who are concussion specialists, and they will give you different answers if you ask them.
Absolutely.
Right?
Yeah.
Here is my answer, and I will own that it's my answer.
Okay.
So it depends on how serious a concussion is. But for the most part, if you've had a concussion before and you kind of know how this goes, and you're like, okay, I know I've had a concussion, I'd like you to kind of shut everything down. Almost like we say cocoon,
Yep.
but only for maybe 1 to 2 days at the most. If your symptoms persist, like if you're like, oh my gosh, my headache's getting worse, or as the hours progress, I would like you to go to the doctor. Okay? The reason why is because we do not want you to have some type of a bleed or something else that might have, lethal consequences, right? But for the most part, if it's a mild hit, you probably don't have any bleeding or anything else going on, and just watch it for a bit.
Yeah.
Past 24 to 48 hours, okay, let's say you didn't have to go to the ER,
Right.
okay?
Yep.
After that point, we're very kind of clear that we want you to get out and do stuff, I mean, I admit, 10 years ago, I was guilty of cocooning people for weeks because that's what the science showed, right? That is absolutely incorrect. In fact, the research is showing, Scotty, that if you rest for more than 48 hours, it could actually have deleterious effects and exacerbates a problem and makes it last longer. So I would like people to get up, start walking, start engaging in things again gradually. Okay, don't go run a marathon,
Right.
But get out of bed and get yourself
Even if
exposed.
it makes you feel bad.
Even if it makes you feel a little bad. Now, if it's making you crash completely, then you may want to kind of moderate that. At that point, you may want to go to the doctor too, you know? I strongly suggest having a medical professional involved. I tend to really love my sports medicine doctors that are concussion specialists.
Yep.
There's a lot of research in the sports realm with concussion, kind of more so than other realms, right?
Yeah.
So if you have a sports medicine specialist near you, I advocate going to them. Some of my best friends are neurologists here, but if we're being really honest, not a lot of neurologists have concussion training.
That has been my experience. Yeah. Is that the neurologists are still very much on cocoon for as long as it takes.
And medicate.
Yeah.
And as we know, cocooning can be deleterious, and actually medications can have the opposite effect as well. Now, if things continue to persist, because that was
So
the
what
second
happens
part
if
of
you're
the question.
a week in or a month in, you still got big symptoms, or you're not improving much? What do you do then?
So typically we ask you to give them about 6 weeks.
Okay.
Stick with your provider for about 6 weeks.
Yeah.
If at that point you're like, you know what, I'm not progressing, or I'm getting worse, or I'm plateauing,
Yeah.
at that point, yes, you want to reach out to someone like us, like Cognitive Effects, because you may be one of that minority. And I say that with a grain of salt, okay?
Yeah.
Because there's a lot more people than you think, right?
Right.
Look at all the people here. Right?
That's very much what I'm learning. Is I'm talking to all these people, including who are seeing the stories and videos we're posting, that are saying, "Oh my God, I had a concussion 9 years ago, and I didn't realize it was having an effect, but I think maybe it is."
Exactly. So when I say minority, I'm kind of saying that, but
Sure.
But you start realizing that these effects can last not just weeks, but months and years.
I think out of everybody I've talked to who's here this week for treatment, I'm the person who's here the soonest after their injury, and I'm 6 months out. There are people here who had their first concussion 23 years ago,
Yeah.
which is crazy.
It's crazy, but here's what's even crazier, is that with advanced neuroimaging, fMRI, we can actually see the rewiring that has occurred in your brain, even though it happened 23 years ago.
Yeah, that's wild. That's wild. I had to do a lot of research on my own to try and treat my concussion, right? And so I started to do research of okay, the cocoon therapy is not the leading edge. There's all sorts of visual and vestibular therapy and nutrition, and there's, checking your hormone levels. There's a bunch of things you can do, right? And when I found Cognitive FX, I found that you guys were following a lot of those same approaches, but you had this program that was only 5 days long, right? And previous providers I was going to, it was like, you see them every 2 weeks and potentially for months, and it's a much more prolonged thing. And I'm already 6 months in, and my immediate reaction was, how could you possibly do anything to my brain in 5 days? And to be honest, like, now that I'm here, you obviously know what you're doing. And I'm at the blind belief level of I'm willing to do whatever they tell me, but I'm still skeptical of the proof is going to be in the pudding of whether I get better or not. At the same side, the treatment portion really seems like it's only 3 days. There's kind of an evaluation day, and then there's kind of a findings and aftercare day. Mm-hmm. I'm still in the disbelief stage of how are you healing brains? How are you making a significant change in only 3 days? What's the kind of theory and science behind that?
Okay, so the first kind of underlying premise is that not only do we do functional MRI, but we're actually doing structural MRIs, right? We're doing a structural MRI of your brain and of your neck. We are dealing with healthy tissue. So we're dealing with a brain that structurally has all of its integrity. Okay?
And generally looks fine on a normal structural MRI.
Beautiful on a normal structural MRI, right? Which some other doctors have used that as an excuse to say that you don't have a concussion.
Right.
But in actuality, even according to the CDC, a normal, perfect brain MRI is actually one of the criteria for diagnosis of a concussion. Okay, think about that for a sec. A normal brain MRI is a diagnostic criteria for concussion.
And if it's non-normal, then you have a more serious
you have
head
a
injury.
serious head injury, okay? We're dealing with normal, so to speak, brain tissue, okay? So one of the reasons why this works so quickly is because we're dealing with healthy tissue, okay? What's happening though is that throughout the injury or the neuroinflammatory effect that concussion had 6 months ago, 23 years ago, that part cannot metabolize the nutrients in blood as effectively, right? Because in order for your brain to fire, it needs to get nutrients, specifically glucose and oxygen, from blood in order to work. But then it has to reroute because your brain still works, right? Mm-hmm. So it has to kind of reroute and find alternate paths and maybe recruit other areas to help it do its job. When you get a scan, it'll show you exactly which parts of your brain are working well, which parts are maybe overcompensating and overworking, and which areas are not working, knocked out and need the compensation.
Yeah.
Okay? But the reason why the brain can change this quickly is because, especially in areas that are already getting too much blood, that maybe are overcompensating, we already know it's working. We just have to train it to not guzzle as much and funnel it to the other areas that need it more.
Got it.
So we're not trying to grow anything new. We're just trying to reroute, like a freeway. If an on-ramp is closed, we are trying to either open up that on-ramp or try to go to the next on-ramp and come back.
Yeah. And you're doing that through really intensive exercise, both cardiovascular and cognitive and all sorts of other modalities. This is kind of like going through an intensive training week, right? It's like doing 2-a-days at football camp or something. I've been through all sorts of different modalities and games and puzzles and routines. If you could only pick 3 treatments for all concussion patients, what would you say in general are the 3 most effective?
So the main things for me that I would do is some physical therapy.
So getting the body moving.
Getting the body moving.
Yep.
And there's theory behind that as well, okay? But I would definitely say some high intensity interval training, okay? The second thing that I think is also very, very important, especially in the acute phase for people with headaches, and who doesn't have a headache in my clinic, right? Is getting good massage and stretching and kind of exercises that mobilize the neck correctly and improve some range of motion. That is really, really huge.
Yeah.
Okay, so that might be the second.
Okay.
The third thing that we really like is our cognitive therapies. So we kind of prepare the body with exercise. Then we activate the brain. Okay, so there's prepare, there's activate, and that is doing the memory tasks, doing the attentional tasks, the focus tasks, the four-letter word tasks, all these things that, you know,
Card sorting and alphabetizing.
Yep. And then the last piece that I think is integral is rest and destimulation. We have to combine all this activation with a destim to let the body calm down. For those of you who are dealing with things like dysautonomia, that's kind of a key word right now with concussion. That is kind of an imbalance in your autonomic nervous system where there's a sympathetic and a parasympathetic nervous system. But what happens is a sympathetic is in overdrive and the parasympathetic that calms your body down is ignored. It's getting overridden. So when we force the body to destimulate, we're teaching that parasympathetic nervous system to kick in and do its job. So those are kind of the three main things that I think are the most important.
As someone who now is on their second serious concussion, one of the questions that's been top of mind for me is how do I avoid getting a concussion?
Oh, jeez.
Because, you know, these kind of stack, you know.
They do. They have a cumulative effect, right?
Mm-hmm. Yeah.
I don't know how to avoid you getting a concussion because the truth is the demographic of our patients spans from child to octogenarians, okay?
And everybody's got different stories about how they got their concussion and how they're getting follow-up concussions. You know, some people have had a bunch.
You look at my professional athletes and it's like their job to get a concussion, you know?
Yeah.
So I don't know how to answer that question other than we want you guys to go back and live your best life. And there are calculated risks to that. Okay, so what I don't want someone to do is never leave their house, but we also know that there are safety precautions that you could take, you know. Always wear a helmet if you're riding a bike. Now again, a helmet doesn't stop a concussion.
Right.
Okay, some people
I
think
learned
that it does.
My first concussion was a hang gliding, we'll call it a bad landing, not a crash. And I had a helmet on.
Yeah.
I had a helmet on.
Well, people think I have a helmet, I'm invincible. I'm like, well, think about it. The helmet protects the skull, but not the brain from inside the skull.
The brain can still slosh around in there.
Yeah.
Does this mean that I should be wearing a helmet all the time as I go through life? I mean, that's sort of the impulse, right? Is like, protect this at all costs.
I'm a mother of 3 children, 3 daughters, and yes, I wish I could bubble them up and, you know, but I mean, in all reality, no. You know, live your life.
Yeah.
Go hang glide, well, you know. But enjoy your life, but just be smart. Take those calculated risks.
What are your plans for the future? I mean, the cognitive FX right now, you guys have what? Our patient load of like 19, 20 patients a week, kind of in there?
Yeah.
It's not very many compared to the number of people that have concussions and are dealing with long-term concussion symptoms.
I know it.
Where are you headed?
We would love this imaging technology to be in every hospital or as many hospitals across the country, right? At CFX, we really kind of specialize in the complicated post-concussion case, but we know that there are people right now getting injured as I speak. What I'd love to do is be able to get anybody a functional MRI no matter where they are, and for them to be able to take that to their local doctor, their local concussion specialist, and get help immediately there. But if we can at least get people more treatment sooner and the right treatment sooner, that would be my ultimate goal.
What do people get wrong with concussion treatment? We talked a little bit about cocoon therapy, but like what else? You know, let's kind of expand on that.
Yeah, gonna get a little controversial.
Yeah, sure,
Okay.
sure. Yeah, bring it. Bring the controversy.
One of the biggest problems that I see, and that kind of bugged me as a concussion specialist, is this idea that, well, MRI and CT look normal, so you don't have a concussion.
Yeah.
I mean, that is just uneducated.
Yeah.
As the clinician,
Yeah.
because clearly it states that that should be normal, and then concussion is, you know, should be considered. Yeah. But when people use that, or when clinicians use that as a rule out, it has much more harmful effects than I think that clinician realizes, right? Because in a way, it really marginalizes that patient to go, well, then what's wrong with me? The next step is then it starts getting blamed on psychology.
Yes, I've heard that. I was fortunate enough not to encounter that, but I've heard other patients say that,
Oh my gosh.
Oh, it's just depression, or it's just anxiety.
you know, and you're like, okay, well, wait, what if I've never really dealt with that clinically before? But now all of a sudden I do. But it, you know, you really kind of get siloed into, oh, you know, there's nothing wrong, so they must be, you know, just a purely, you know, it's just in their head. Well, yeah, it is. It's completely in my head. But that can be very harmful, because then that patient starts doubting their own experience. They start questioning their own judgment. Then they start taking medications, right? And a lot of us will, you know, we'll take what our doctor recommends, because we know that doctor, you know, has our best interest, and then they start being guinea pigs for medications.
Yeah.
Okay, so this is the other part of this, is that...
Yeah, let's talk about medications.
Oh my gosh. So there's so many different medications that patients are being put on, and some of them I think are fine, but these are all for short-term use. These are not meant for long-term use.
Yeah. You don't live the rest of your life on an anti-seizure medication for headaches.
You would hope not, right?
Yeah.
And then think about the developmental effects of putting young kids on some of these medications.
Yeah.
You're lucky to get to us in 6 months. Most people take years, about 3 to 5 years to get to us. They've been on medications for this long. And again, nothing to fault that clinician, but they're just they're going, I don't know, let's try this. Yeah. But with most of our concussion patients, because the etiology of the anxiety and depression isn't what's typical, meaning that this actually came because of the injury, those medications don't work in the same way.
Yeah.
So they end up having a lot of the negative side effects, but not really experiencing a lot of the benefits. So what's interesting is a lot of my patients, I'd say half of them come to me with still the drugs they're on because they're still trying.
Yeah.
The other half are like, oh, I stopped that.
Yeah.
You know.
Yeah.
For patients that come to me, I'm actually really trying hard to get them off some of the medications, especially if they are not noticing any real benefit from the medication. So that is probably another big thing. The last thing that I think I will say is that's still happening is that cocooning.
Right. The just rest.
And
I was told that so many times. So just rest, see me again in 3 months, you know. And that means don't work, don't drive, don't be on screens, don't read. Like, I mean, that's the list they give you, right? Don't exercise. And one of my questions is, well, what the heck do I do? You can only sleep so many hours in the day, you know, like.
Do you think that method is going to increase or decrease your risk for depression or anxiety?
Oh, it hugely decreases depression and anxiety, particularly once you're like, okay, I'm 3 months in, I've been, you know, lying on my back for 3 months, and it's not getting any better.
Yeah, who wouldn't be depressed? Yeah. Here's another thing that I really want to normalize for everyone who's listening that might have dealt with a concussion or still dealing with one, or maybe realizing, maybe I am this way because I've had a concussion. Most of my patients, a vast majority, will report suicidal thoughts. Okay, this is real.
Yeah.
And it's what we call passive ideation, where it's more of like, if I have to live like this forever, I don't want to do this.
Yeah.
Or I don't want to wake up like this another day. Or I think I'm better off to my family if I wasn't here, if this is how I am.
Yeah.
Okay? Those are real thoughts. They're normal thoughts for patients who are struggling with concussion. It's not normal if you have a plan, if you're actively wanting to do it, if you have the means to do it. So there's a big difference there.
Yeah.
And I strongly suggest that you talk to your loved ones, talk to your wife, your spouse, your parents, tell them about the feelings that you're having.
Yeah.
I had a consult just yesterday with a patient who played college football and came on the consult to me saying, I know I have CTE. And I said, there's no way you know you have CTE. So first of all, I want to alleviate this fear that it's this all prevalent thing and that everyone's going to get it.
Let's explain what CTE is.
All right. So CTE stands for chronic traumatic encephalopathy. And very simply put, it's diagnosed after you pass. So it's not even diagnosed when you're alive. And it's diagnosed by the types of little plaques that they see in your brain post-mortem. Okay?
And it's sort of a deterioration of the brain from successive concussions?
Yep, exactly. Yep, that's what it is. Now, what I want to do, though, is kind of dispel some of these myths that everyone has it. So number one, understand the real numbers, which is it's a very small percentage of people who actually get CTE.
Yeah.
So that's the first reason, a way to kind of moderate the fear.
Yeah.
The second is a lot of people fear something if they don't know, if they feel like there's nothing they can do about it.
Right.
Right? But with empowerment comes some control, right? Yeah. Control kind of takes away the feeling of hopelessness and helplessness. So knowing that, okay, well, let's see what's really going on with my brain. Let's get you scanned. Let's see what we can actually do to help treat it. Knowing that there are treatments out there is very empowering.
Yeah.
So those are the two main things that I think people can consider. Can I ask you something?
Sure,
though?
yeah, please.
What I'd love to hear from you is, can you articulate, for those who are wondering,
Yeah.
why is this so different? I know,
Yeah.
but I want to know from a patient's
Yeah.
perspective.
Some of it is in really basic ways that I don't know how you're going to react to this,
That's
but
okay.
as a patient, so I had my concussion in July. For the first couple months, I went to the urgent care ER and got a CT scan, which was normal, and I was told cocoon, and then didn't receive any treatment after that because I was so out of it that I couldn't organize care for myself. The amount of time I spent scheduling appointments and going to and from appointments, it's a full-time job. And you can't do it. I couldn't do it when I was at my most severe, right, at my worst. So one of the things that's really notable out here that's so simple is, it's so simple, but in practice I know it's not, is that I come here for 5 days. I take the shuttle from the hotel that you guys have already, made arrangements with, and I come to the patient waiting room, and someone comes by and finds me and takes me to my next appointment. And just not having to quarterback my own care and project manage my own care, and I've had, providers that I had to work to keep them on task in a conversation so they could make a decision about how they were going to change my medication. I was having to bring family members with me to take notes to make sure that the doctor prescribed what they said they were going to prescribe. And so just that level of constantly having to wonder, is the provider I'm seeing competent, and how do I need to project manage them, and what adversarial advocation do I need to do for myself to make sure I'm getting the care that I want? I just don't need to do that here. I can just relax and focus on getting better and focus on doing whatever you tell me, and not have to be constantly worrying in the back of my brain, is this the right treatment? Are they doing what they said they would do? Da, 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 da.
Once you're here, it is so clear that you should find a doctor that this is kind of all they do. Not that those other doctors weren't good, but they're worried about all their other patients and all the other issues, and you're not going to die from this. That's the thing. That's why the ER will just punch you out, right?
Yes, right. Right. It's not life-threatening.
It's not life-threatening.
Other than potentially suicidal ideation, you're not going to die from it, and so you get kicked to the back of the line a lot.
Yes.
Of you can wait another 4 months, you can wait another 6 months, whatever. And the reality is I can't, right? I haven't been able to work. I've barely been able to function. From my perspective, this is the most important thing in my life to address right now.
Exactly.
And it was very hard to find providers, even concussion specialists, that really embraced that. The report that you provided me, after my first scan was so actionable, right? It was so much, these are the different tasks that your brain needs to do and that we've tested, and this is your score on how well your brain is activating in those areas, and these are the areas that are specifically bad. That I could absorb in a way that I could understand.
Well,
right?
And that's the other thing, is that not all fMRIs are created equally.
Yeah.
So you may be able to get an fMRI at another institution, but if they're not using that fMRI to directly guide treatment, it's only going to tell you that, your brain's not working great.
Right.
And you could have done that without an fMRI, right?
And the fMRI that I got was really rudimentary compared to the protocol that you have. So it was just auditory, and there was no task. It was just listen to some words through the speakers, and they did one side, and then they did the other side, and then they did both sides. And I just have a hard time believing that really gives a very complete picture of the brain. And what I got back was, it was I think a DTI scan.
Oh,
Does
yeah,
that make sense?
Yeah, absolutely.
And I got back this table of numbers that was kind of how far am I off the normal in the fiber tracts that connect different parts of the brain. And so it'll say, the fiber tract for this part of the brain is not functioning properly, but I have no clue what that means. And even if I go do the research and say, okay, what does that part of the brain do? I still have no idea of what should I
How do you treat
do
it?
about that?
How do you treat it?
And what does that mean? What implication does that have on my life, right? How do I treat it? How do I change what I'm doing?
Yeah.
And whereas it really seems here like you have there's a deep understanding. So, I'm sold. I think the proof's going to be in the pudding of, does this actually change my symptoms?
I can't wait to see. I can't wait to see what it does to your brain, because neurovascularly, your brain's changing.
Me too.
Symptom-wise, it'll happen. Most patients feel some difference by Thursday or Friday,
Yep.
but we always tell patients, okay, we're not like a magic pill. You can't just take a pill here and everything goes away. This is just science, just getting your brain to change. But you have to kind of go back into your real life, go back into your real world, accommodate and assimilate to your normal gradually, okay? And it might take weeks to months before you start feeling, 85, 90, 95+% better. It kind of just depends, but yeah, I'd say about 85% of our patients see about 65 to 75% improvement in their symptoms in that 1 week program.
That's amazing.
Yeah, pretty cool.
Like I said, I'll believe it when I see it. Thank you so much.
Thank you, Scott.
This has been fabulous.
Thank you, everybody.